Hello and welcome to the top stories of this week's IACM bulletin. Cannabis extracts can alleviate burns. CBD reduces brain temperature in seizure onset zone of patients with epilepsy. CBD reduces inflammation of the gums or gingiva. Cannabinoids may mitigate burn progression. In a study with pigs suffering from burns, topical application of a cannabis extract with very low THC and CBD concentration decreased and mitigated burn wound progression in comparison to control treatments. CBD reduces brain temperature in the seizure onset zone of patients with epilepsy. Investigators of the Department of Neurology at the University of Alabama at Birmingham, USA, investigated 25 participants with magnetic resonance spectroscopic imaging approximately 12 weeks apart. 8 patients with treatment-resistant epilepsy were imaged before receiving CBD and after 12 weeks of CBD therapy. Treatment was started at a daily dose of 5 milligrams per kilogram body weight with biweekly titration based on response and tolerability. 17 healthy controls were also imaged twice. Participants with treatment-resistant epilepsy had abnormally high peak brain temperature within their seizure onset zone, that is the zone where the seizures start. That decreased after CBD initiation. Seizure severity scores improved also after CBD treatment. CBD reduces inflammation of the gums or gingiva. According to a placebo-controlled study, CBD in a dental gel and toothpaste reduced gingival inflammation. Investigators of the Faculty of Medicine and Dentistry at the Palacky University in Olomouc, Czech Republic, first demonstrated that cells of the gingiva express the CB2 receptor. The clinical study was conducted for 56 days in 90 participants. They were divided into 3 groups. One receiving dental gel without CBD, group A. One with 1% CBD, group B. They received a gel with CBD and a corresponding toothpaste. And group C used a dental gel containing 1% chlorhexidine and a toothpaste without CBD. The basic research showed that CBD exerts anti-inflammatory and antimicrobial effects. In the clinical part, significant improvement was found for gingival bleeding and other symptoms after 56 days of therapy with CBD. Authors concluded that CBD reduced inflammation and the growth of selected periodontal pathogenic bacteria. The clinical trial demonstrated a statistically significant improvement after CBD application. Some further news in the bulletin. Increase of the concentration of the endocannabinoid anandamide may improve treatment results against melanoma. Cannabinoid glycosides, which can be produced from cannabis extracts, show increased anti-cancer effects in several cancer controls and cancer cells. Mulberry extracts may influence the endocannabinoid system. Many Danish dog owners use CBD for the treatment of their pets, and a few use THC. CBD exerts sedative effects through activation of the serotonin receptor. A majority of French psychiatrists are in favor of cannabis legalization. Increased concentrations of endocannabinoids, both anandamide and 2-AG, exhibit anxiolytic effects. Antiviral effects of CBD and terpenes against the influenza virus and the coronavirus. CBD may be helpful in ulcerative colitis. CBD may reduce anxiety in healthy dogs upon temporary separation from their caregivers. These were the top stories of this IACM bulletin. Thank you very much for your interest.